If places don't have affirming treatment and really all that affirming means is, do I meet you where you're at and support you? Where do these young people go? And we all know what a lack of belonging does to a person's mental health.
We're clinicians, we're meeting people where they're at. That doesn't mean that we don't ask questions or get curious about someone's identity and what that means to them and where they're at in their life and their world.
In early adulthood, the components of social connection that are most influential for overall health outcomes are the structural and functional aspects. The general feeling during early adulthood is that there is an emotional safety net available, a way that you feel you belong somewhere. Then health-related outcomes tend to look better compared to this basic sense of belonging is lacking.
I think it's so important that we understand the significance our patients place on their relationship with us. We're there to sort of help catch young adults in their transition to adulthood as they search for meaning and belonging. As clinicians, we're not only striving to foster strong therapeutic alliances, but I think it's equally important that we not lose confidence when that seems not to be happening, recognizing when and why our alliances are faltering and how this might relate to the loneliness our patients experience outside of treatment.
I wish I was going to say something totally groundbreaking, but it is just as simple as how do we build rapport and how do we collaborate with the client? Everything is based off of the ability and willingness of the client to work with you. We don't have to get clients to commit to never suiciding. That often is more than a client is willing to commit to. I mean, it's a lot for us to ask. We can try and solve chronic depression all day long. We can try and solve chronic suicide ideation all day long. Or we can look at making your life worth living. And honestly, that's what community integration, the work that the Dorm and Pathfinder and 360 are doing.
Usually when someone's going through a period of distress, what helps the most is just to be there, to know that someone is, in the room with them, curious about their lives, wants to know what's going on. You're thinking about your individual clients and the people that you work with and really care about them and want to think about them really as individuals. This is obviously really complicated and we're just scratching the surface.